Most people don't notice the early signs of decline. Not because they aren't paying attention, but because the signs are quiet. They don't announce themselves. They blend into the background of a busy life, and by the time something feels obviously wrong, the process has often been going on for years. That's what this is about. Not fear, not worst-case scenarios. Just the signals your body actually sends, early, reliably, and consistently, when something inside is starting to shift in the wrong direction. These aren't rare findings. They're patterns that show up in clinical practice over and over again. And most of the time, when patients finally hear them laid out clearly, their response is the same. I've had that for years. I just thought it was normal. It isn't always normal. The first sign is fatigue that sleep doesn't fix. Not tiredness after a long day. Not the kind that resolves after a weekend of rest. This is fatigue that's become your baseline. The kind where you wake up already depleted, where coffee barely moves the needle, where you feel like you're carrying extra weight just getting through the afternoon. There are several things that can drive this. Thyroid dysfunction is one of the most common and most missed. Your thyroid controls metabolic rate, essentially how efficiently your cells produce and use energy. When it slows down, everything slows with it. Blood doesn't move as well. Temperature regulation falters. Mental clarity softens. And the defining feature is that no amount of sleep corrects it. Unresolved inflammation does the same thing. Chronic low-grade inflammation, driven by poor diet, sleep disruption, excess visceral fat, or persistent stress, keeps your immune system in a semi-active state. That activation has a metabolic cost. Your body burns energy fighting a threat that's invisible, and what's left over for normal function is reduced. If fatigue has been present for more than a few weeks without a clear explanation, it's worth investigating, not assuming it's just stress. The second sign is increased frequency of illness or slow recovery. When your immune system is functioning well, you get sick occasionally, recover in a reasonable time frame, and move on. When that pattern shifts, more frequent infections, longer recoveries, symptoms that drag on, it often means immune regulation is compromised. Vitamin D is one of the most significant factors here and one of the most consistently low in the general population. It's not just a nutrient, it functions as a signaling hormone that modulates how your immune cells respond. Low levels are directly associated with increased susceptibility to respiratory infections and impaired recovery. Zinc deficiency follows a similar pattern. It plays a central role in T-cell development and function. Without adequate zinc, your immune response is slower, less precise, and less effective at clearing infections. If you're noticing that you're catching things more often than you used to, or that when you do get sick it takes longer than it should to fully recover, that's worth paying attention to. The third sign is changes in digestion that have become routine, not occasional bloating after a heavy meal, not a single episode of constipation, but ongoing changes, irregular bowel habits, persistent gas or bloating, a general sense of discomfort after eating, that you've started treating as normal because they've been present so long. Your gut is not a passive system. It's home to trillions of microorganisms that regulate inflammation, produce neurotransmitters, influence immune function, and play a role in how nutrients are absorbed. When that ecosystem is disrupted, the effects extend well beyond digestion. Dysbiosis, an imbalance in gut bacteria, is now linked to conditions as varied as depression, autoimmune disease, metabolic dysfunction, and cardiovascular risk. The gut barrier is also a critical checkpoint. When it becomes more permeable than it should be, which can happen through chronic stress, antibiotic overuse, alcohol, processed food, and other factors, partially digested proteins and bacterial fragments pass into the bloodstream and drive systemic inflammation. Digestion changes are often the earliest and most consistent signal that something in this system is off. They're worth treating as information, not inconvenience. The fourth sign is cognitive sluggishness, difficulty concentrating, memory lapses, or a persistent sense of mental fog. This one often gets dismissed, especially in midlife, as a normal part of aging. But it isn't always aging. It's often the brain telling you something in the body is interfering with its function. Blood sugar instability is a major driver. The brain is almost entirely dependent on glucose for fuel, and it's extraordinarily sensitive to fluctuations. When blood sugar swings sharply, up after meals, then dropping, cognitive function drops with it. Over time, consistently high insulin levels drive inflammation in the brain itself. Sleep quality is another factor. Not sleep duration alone, sleep architecture. Deep sleep and REM cycles are when the brain clears metabolic waste products through the lymphatic system, consolidates memory, and repairs itself. Disrupted sleep, even without obvious insomnia, can impair these processes significantly over weeks and months. If you notice your mental sharpness is not what it was and it isn't explained by a particularly hard stretch at work, it's worth looking at blood sugar regulation and sleep quality as starting points. The fifth sign is changes in skin, hair, and nails that appear gradually. Your skin is sometimes described as a window into internal health, and there's real clinical basis for that. Skin that becomes increasingly dry, hair that thins or changes texture, nails that develop ridging, brittleness, or slow growth. These often reflect nutritional or hormonal status. Iron deficiency is one of the most common nutritional deficiencies globally, and hair loss is frequently one of its early presentations, well before anemia becomes detectable on standard labs. Ferritin, the storage form of iron, can be low enough to affect hair follicle function, while standard hemoglobin values still appear normal. Thyroid dysfunction shows up here too. Dry skin, coarsening of hair, loss of the outer third of eyebrows. These are textbook findings in hypothyroidism. Biotin deficiency, zinc deficiency, and inadequate protein intake all have their own dermatological signatures. Changes in how your skin and hair look and feel aren't purely cosmetic. They're often among the first externally visible signs of a deeper imbalance. The sixth sign is elevated resting heart rate or changes in exercise tolerance. A resting heart rate that has been creeping upward, or a reduced ability to sustain physical effort that was previously manageable. These are meaningful physiological signals. Cardiovascular conditioning is directly tied to the efficiency of your heart and vascular system. As arterial flexibility decreases with age, or as inflammation accumulates, the heart must work harder to maintain adequate perfusion. That shows up as an elevated baseline heart rate and reduced exercise capacity. Autonomic nervous system imbalance is another factor, specifically reduced vagal tone. Your vagus nerve acts as a brake on heart rate and an activator of the parasympathetic nervous system. Low vagal tone is associated with higher resting heart rate, reduced heart rate variability, and higher cardiovascular risk. It's also closely tied to chronic stress and poor sleep. A resting heart rate consistently above 80 beats per minute in an adult is worth discussing with a clinician. It's not automatically pathological, but it's a signal that deserves attention. The seventh sign is persistent low-grade pain or unexplained aches. Not post-exercise soreness, not a pulled muscle, but diffuse, traveling, or chronic discomfort. Joint stiffness in the morning that takes more than a few minutes to resolve. Muscle aches without a clear cause, or a general sense that your body doesn't feel as comfortable as it used to. Systemic inflammation is almost always involved. The inflammatory molecules that drive chronic disease, interleukins, tumor necrosis factor, C-reactive protein, are the same ones that cause pain and tissue degradation when chronically elevated. This is why conditions like metabolic syndrome, cardiovascular disease, and autoimmune disorders all have a pain component. Omega-3 deficiency is clinically relevant here. EPA and DHA, found in fatty fish and quality fish oil, are direct precursors to anti-inflammatory signaling molecules. When the ratio of omega-6 to omega-3 in the diet is significantly skewed, as it is in most Western diets, the balance tips toward a pro-inflammatory state that amplifies pain signals. Persistent aching without injury is your body telling you that something in its chemical environment has shifted in a direction that isn't sustainable. The reason these 7 signs matter is not because any one of them means something catastrophic is happening. Most of the time, individually, they don't. The reason they matter is that they're early, and early is when intervention is most effective. By the time disease is obvious, by the time it shows up clearly on labs, produces dramatic symptoms, or leads to a diagnosis, the underlying process has usually been underway for a long time. These signals are the earlier version of that story. If you recognize several of these in yourself, the appropriate response isn't alarm, it's action. Get comprehensive labs that look beyond basic panels. Address sleep. Assess your diet for nutritional gaps. Reduce chronic stressors where possible. Work with a clinician who is willing to investigate rather than just reassure. Your body is not breaking down quietly, it's communicating. The question is whether you're paying attention early enough to change the outcome. And there you have it. Take this knowledge and take control of your health. Thank you for watching.